be talking about seizure first aid and safety. So just knowing the basics, very approachable information today. Just a little bit about foundation. But yeah, we work to ensure that the most seizures have an opportunity to live their lives to their full potential. So my background in social work, like bringing to schools and lawyers, anyone who wants to see the first aid safety. And also working on cheerleading program with adults at Epilepsy, providing individualized support to them, helping them done as individually as possible. And we have a team of adult report. It's great for facing each peers to connect with one another and be able to relate to each other. See, are any of you local to see this? Yeah. Oh, okay. Okay, so yeah, today we're going to be talking about common seizure types and their possible impacts, and then knowing the appropriate first aid, recognizing when a seizure is a medical emergency, and then how to provide that social support. So, of course, here are the reasons why no seizure first aid, because seizures can cause harm. You know, I have individuals that I've worked with that have fallen down the stairs, broken teeth, or burned themselves, and so on. So that's why it's just so important to know what to do and I just wanted to talk about SUDEP real quick. It's sudden unexpected death in epilepsy. So each year, more than 1,000 people with epilepsy die of SUDEP, and it's very rare for children, but it is the leading cause of death in adults. Okay, so epilepsy is a chronic neurological disorder characterized by a tendency to have current seizures. Emphasizing because somebody may have an isolated seizure in their time, and that wouldn't necessarily develop epilepsy, long-time seizure. And a seizure is a sudden excessive discharge of electrical activity in the brain that can alter movement, sensation, behavior, or speech. It really depends on the area of the brain that's affected. And as you all know, there's 1A and epilepsy can be affected often. So altered brain function can affect how brain networks develop and communicating, increase the likelihood of electrical activity in the brain, leading to seizures. These are often the seizures that you see. So the myoclonic seizures, the atonic seizures, and others are seizures, absent seizures, and generalized tonic-clonic seizures, also known as the grand mal seizure. And we're going to get into these as we go. So, some stats about epilepsy here. Over 65 million people worldwide have epilepsy, and 3.4 million Americans. So, to visualize that, that's a little more than half of the population of Missouri. So it's slightly more common in men than women, and of course, you know, anybody can have this. And there's some myths about epilepsy. Have any of you heard that you can swallow your tongue during a seizure? Yeah. So of course, you guys can't happen. That's kind of maybe more of a gold school then, but your tongue's attached. Somebody may bite their tongue during a seizure. You have to close it. And have you guys heard that you're supposed to put one spoon in someone's mouth during seizures? And you don't heard that? The leather wallet, that's another thing. You don't want to put anything in a person's mouth. Of course, epilepsy is not contagious. It's not mental illness. It's a medical condition. And those seizures are not a medical emergency. And the individual may have that they are having a seizure and maybe they are competitive. There's some important terms that you might see maybe from a doctor in a seizure action plan. So I won't spend too much time here. This is a lot of information, but An aura is the actual start of seizure. It's a warning sign, but not everybody with epilepsy seizures have an aura. It can look and feel different from person to person. So I have an individual I work with that has like a tingling feeling of dangers before she goes into a seizure, and that allows her to get some more safe. Oh yeah, and it's over for a period during sudden attacks, such as a seizure or stroke. Pre and post exor refers to the period of time before or after the seizure. And then idiopathic refers to a disorder of unknown cause. Intractable is it's difficult to alleviate remedy. The example you see here is intractable seizure and difficult to control with the usual anti-epileptic drug therapy. And the refractory means treatment fails to achieve seizure freedom for 12 months or more. The status of epilepticus is a prolonged seizure, usually defined as lasting longer than 5 minutes, or a continued, repeated seizures happening back to back, or a continuous state of seizure activity, and that would be considered a medical emergency. And then here are some common causes of epilepsy. A lot of times it's linked back to genetics. Just as other causes. Okay, now we're going to get into why your parents is seizure first aid. Okay, so we're going to, there's actually over 30 different types of seizures, but we're going to be talking about just like 5 main seizure types today. And we're going to be talking about generalized seizures that involve the whole brain, and then focal seizures, which involve just part of the brain. We're going to start with the seizures. So during the seizure, we'll have the sudden loss of them. So oftentimes they will like collapse suddenly, or maybe not able to swim, and then they drop off trips. And these are really quick typically, and the recovery time is pretty quick as well. So just some safety tips. Of course, it depends on person to person, but we can use helmets or any other types of gear. Just closely supervised, especially during like active seizure encounters, and just making the environment as safe as possible. And then we have the generalized absence seizure, and during this seizure, the person is going to have a brief lapse of awareness. So they see possible chewing or blinking motion, and just staring off in space. A lot of times this can occur 50% of the day, and it's often confused with daydreaming or attention. And I mean, every time I talk about this one, I will have people think, well, I stare out in space, but there will be a noticeable difference because you won't be able to get the person's attention. And they are going to view where that happens, likely. And they include they're in a conversation, and they can come to and realize that they missed the conversation. But yeah, anybody here familiar with this feature? Yeah. Usually I like to talk involved, but I know it's kind of difficult because I have no microphone. So at the end, if you guys want to share any of your experience, that would be great. Then we have the most commonly known seizure, the generalized time on it. There's Grand Law, but I hear too. They changed the name, I think, in 2016 to confuse everybody. So during the seizure, the person will lose consciousness, and you'll hear them cry out and fall, and you'll see the convulsions. So the stiffening of the arms and legs, followed by rhythmic jerking. Oftentimes, shallow breathing will occur and drooling as well. They may turn into bluish color. They may go to the bathroom themselves too during the seizure, and it typically lasts 1 to 3 minutes. And it's often followed by the person feeling very confused, very tired. Individuals that work with go into peace for hours. That's the normal. Might be irritable. It can be really sore. It's hard on the body, and maybe have some speech difficulty. A few people I work with also get really nauseous and start vomiting too after the seizure. So what to do? Stay calm and track the time, because if the seizure goes over 5 minutes, that is usually when it's considered a medical emergency. And I guess they do check for seizure disorder every day. They're very slim. They have epilepsy if they are in public. And then we want to protect them from any hazards, just moving anything that they can actually harm themselves on. And put a cushion in their bed as well. Focusing with this, things like the jacket, anything soft, not repeatedly getting their head on the floor. Another important step is to turn them on their side, and that's to prevent them from choking on their saliva. And then after the seizure, just remain with the individual until they are fully alert again. Don't give them anything to eat or drink right after a seizure either. You're going to make sure they are fully conscious again before you do that. Or providing that social or that support. And I'm going to be referring to seizure actions and playing quite a bit today. I'll show an example. I'm sure a lot of you are familiar with that. But it's just a great tool to help keep the person safe. Whether it's in a school setting or work, anywhere, I always encourage to utilize that seizure action plan. Which one? But then the first aid for a person in a wheelchair, generally speaking, is always followed your doctor's list too. But you're going to try and keep the person in the wheelchair if possible, and secure the wheelchair. And you can fasten the seatbelt to sleep so that the person can fall in. Protect and support the person's head, and make sure the breathing is not blocked. So that's why the kids both of their mouth. And also pad the wheelchair to prevent injuries to limbs. These are some great posters that I always wish on people. We brought it today too. It makes it more approachable, really, and just because it can be scary to see seizure, right? So we just want to make sure everybody knows what to do. And so yeah, I would say these are pretty much. And then what never to do, which we kind of touched on, but you never want to put anything in a person's mouth during a seizure. And you never want to pull down or strain a person either. And you have to take oral medications unless they have a seizure rescue medication. And no food or drink following the seizure. Until they're like fully. Okay, next we have two seizures that fall apart of the brain. We have the full aware seizure, and during the seizure, the person is actually going to be aware of having a seizure. So often you're going to see some rhythmic movement isolated to one side of the body. So just like twitching of the arms, legs, face. And then the person may have sensory symptoms specific to them that you have no idea about. Like maybe like that's a really tingling sensation in their body, or weakness, they hearing something no one else can hear, or smelling something that no one else can smell. I had an individual that smells scrambled eggs during this seizure, and then another one that smells like burnt tires. And then like maybe having a funny taste in their mouth and so on. A lot of times they also hear it described as like a feeling of anxiety. These usually last less than 1 minute, and there's not a lot of seizure first aid. But this one specifically, what I do is just speak calmly to them and say to them, just be okay. If they're holding anything, I'll take that from them, and just say to them. And this can look different for person to. And then we have the impaired awareness seizure. So during this seizure, the person is not going to be aware, but it's going to either be walking around And so this one can kind of be confusing, but it often begins with a blank gaze stare, and then you'll see repetitive purposeless movements. So maybe picking up an object over and over again. We've seen that before, like walking around in circles, speaking, not making sense, lip smacking, and these typically last 1 to 3 minutes, and it's often followed by the person who's tired, they get confused, they might have a headache, and they might be nauseous. It's also important to note that the person may become reactive if they're restrained. They're going to restrain them. And a lot of times this one is confused with intoxication from abuse, especially in law enforcement, and or just behavioral concerns. So during the seizure, we want to stay long and reassure others, and then track the time as well. And again, do not restrain the individual. And remember that they're not going to be able to respond to you because they're not going to be fair kids. So don't expect them to be able to obey any verbal instructions. Then you just want to gently direct them away from any hazards. I always use the example of the stairs, and you're worried you're going to fall down these stairs. And just stand in front of them and just drift away gently. Let's stay with them until they are fully alert and aware. Let's recap. When a seizure is an emergency, it's a person's first time seizure, of course. And if the convulsive seizure lasts longer than 5 minutes, if repeated seizures happen without the person regaining consciousness, and if the individual is injured, that's going to be more. Anytime the seizure occurs in water, even if the individual appears to be okay, you still want to take that precaution. And if their normal breathing does not resume, or of course, if an emergency evaluation is requested by the individual or their caregiver. Follow that seizure after. Here's an example of some possible seizure triggers. The number one is medication, but stress is a huge one as well. And overheating in the summer, I see quite a bit too. And sometimes it happens at a certain time of day, more likely, like right in the morning or at night. It really depends person to person. This is just some examples. I have individuals in the summer that will be like out in the heat and then go into a very cold waiting room, and that has triggered seizures in them. So, and then of course the flashing lights, which we all know is really scary. And the movies or video games. Okay, here's an example of a seizure action plan. How many of you are aware of that? Again, some of them are. Yeah, I always think it's a great tool. We have it on our website. I have some examples today too. But it just allows confidence that the person would not see seizures. And this doesn't need to be signed by a physician. But we also have the parent guardian questionnaire that definitely has to be signed by a physician. And it has the exact same information. And this is an example of seizure observation records video. This is for people as well, because it's just useful information for their treating physician. It's kind of blurry, I guess, but it just shows any seizure or what area of the body is affected, any possible triggers, just all the information that can be useful. Of course, that's not required by anybody to fill this out, but if they have that information, it can be useful. Just some tips for seizure observation. I always struggle with timing the seizure because I jump into action mode and I forget to hold the time. So I will now screenshot my phone and then go to action mode and then go back and see how much time it's passed. And that's really helpful for me personally, but I'm also writing down what happens as soon as you can, because it's really easy to forget information in like a very stressful situation. So that's what's for you. We're really reading. Just wanted to briefly talk about some treatment options. So the anti-seizure medications are the main form of treatment. And with those, some pretty harsh side effects sometimes. So, like irritability, I see like drowsiness. So just keeping that in mind too, it's pretty bad. And then there's epilepsy surgery, which we hopefully won't get into today, but there's also the medically prescribed ketogenic diet, and then different devices as well. Have you guys heard of the ketogenic diet as a treatment for epilepsy? Yeah. So yeah, it's basically finding that brain fat energy has a seizure. This doesn't always work. I have been sure that has some very terrible things to say about the site. It didn't work for him. He's a very good shooter. Setting your guidance to be really difficult. If you really have to have a strong commitment from everybody and that person's life to follow this. And sometimes in adults, you see it as a modified acting site. But again, it doesn't really work. This is just an example of a device. It's the vagus nerve simulator. So there's a picture with live vagus nerve. And they deliver electrical stimulation to the vagus nerve that plays impulses to widespread areas in the brain. We can stop an ongoing seizure with the use of a magnet to activate it. And then just briefly touching on the rest of medications. So there are various sometimes there's Resolve, there's the dicetyl, and there's the nasal sprays, which are probably the most common. And I always encourage everybody to talk to their local chapters about patient programs for these different medications. So they can be very costly. Oh, and Baltimore actually has changed the age limit for people 2 years of age and older. It used to be 6. So that happened a year ago. Okay, so it's almost this year, but just wanted to talk about the impact of these in daily living seizures. So after a seizure, they might have to be readdressed. They may not be able to go on with their day. They may need to rest for a few days after too. So just keeping that in mind, and then seizure activity without the obvious physical symptoms still affects one's daily activities. And epilepsy can influence how a person feels about themselves, their independence, and their quality of life. Just because sometimes it can feel really limiting, a lot of people people strive. It is very between 6 months to seizure free and get by doctor. And then if you limit this work and safety too, and then like we talked about. Also, just wanted to mention that the Americans with Disabilities Act prohibits discrimination based on a person's disability. So it still does happen, but we encourage you to reach out to your local chapter and for your dad. So this is the last slide here, but I think when you guys are using tips for supporting people with epilepsy. I was like encouraging independence as much as possible and just not limiting anybody because all individuals with epilepsy have a right to environments where people understand their disorder and they're accepted and included in all aspects of life. Thank you all. Does anybody have questions? Yeah. Thank you so much. I just wanted to share something that's been helpful for us. There's an app called Seizure Tracker that you can get on your phone, and because it is difficult to know when it started. And so you can record the event. It'll record a video, and then you can do the time, date. You can make notes as far as what they look like, things that were happening, triggers. And it's been helpful to document so we can actually go back and our doctor and go back so they can see what type of seizures she's had. Thank you for sharing that. So it's called Seizure Tracker. There's called Nile and then FC, but I don't know if they have a feature of like seizures, so that's pretty awesome to share that with others. Thank you.
Well, this son was young. He had cerebral seizures until he was 6 or 7 years old. His doctor was very aggressive and treated, gave him trileptal. Once he finally stopped having seizures and stopped taking the trileptal, he noticed that his speech and other activities seemed to blossom. And his neurologist said, yeah, the trileptal can hold it back. Just let's take one treatment. Was it a mistake to so actively block the seizures when talking mentioned earlier might have allowed them to develop that? Does that make any sense? Is that a note taken?
It does make sense. And so that brings us to sugar. So I mean, you know, I've heard this before, but I don't, the ones that have really answer that question. But thank you for sharing that. And thank you again for the presentation. My question is, because our kiddos do have a lot of cerebral seizures, is there anything like what we used to do when we would notice a seizure coming on? If you started putting it in power, you told them just have to go until the seizure would subside. Is there any more recommendations towards the fecal seizures? Do you know anything more? I do. I think that that's really what you should do. Yeah. Thank you so much for this presentation. I have a question that are there any particular types of seizures which are more common for the chronic syndrome? Yes, actually. So I believe these are probably the most common. So the myoclonic, the insulin, absent seizures, and the generalized tonic-clonic or branch ball seizures. Any other questions? Considering the way that the seizures are very common, can you speak towards like seeing a hepatologist, like if that would benefit over a neurologist? If, I mean, I really can't say. I think it kind of depends person to person as well. a lot of times, maybe like a neurologist would refer you to that. And what about, yeah. Thank you all so much. Think you have a few minutes break. Just stretch your legs and breathe here and 50.